Welcome to Stem Cell Activators with Dr. Joseph Christiano. Dr. Joe is a naturopathic doctor with over 45 years of experience in natural health. Listen and discover how stem cell activators are helping people enjoy a greater quality of life.
Hi, this is Dr. Joe Christiano, and welcome to my show. I'm glad you tuned in, and if you're dealing with health issues or you know somebody that is, you tuned into the right show. You know, if you watched my show before, if maybe this is the first time, you're going to see real quickly that I like to delve into the root cause of issues. You know, the body's designed to heal itself, if you know that or not. And because of that, when something is wrong or when the body's out of balance, it'll send up all these warning signs or symptoms. And if we're not careful, if we ignore those symptoms, that root cause is going to cause the body to become chronic in whatever condition you're dealing with. It's kind of like the idiot light on your dashboard. They call it an idiot light because it's an idiot who waits till the light goes on before they change the oil. Okay? Now, I'm not saying you're an idiot or not, but nevertheless, you're driving your car and you look at the dashboard and you're on E. Now, I don't know if you've ever been there before, but I'm going to warn you in advance, don't drive too much longer that way because you're going to run out of gas because your tank is empty. Same thing with the human physiology. The body's designed and created in such a unique fashion that, you know, when something's out of balance or something's wrong, regardless of what it is, it sends up those warning signs. Now, not to an idiot, it signs it to you and I to let us take advantage of the root cause, or at least address the root cause so that it doesn't get worse, or in this case, chronic. And a lot of times that is the case. And so what do? We go to our physician, we go there with a myriad of symptoms. They sit you down, how you doing today? Tell me what's going on. Well, my knee hurts, my back is killing me, my neck is crinked, you know, or my stomach's upset, on and on and on with symptoms. And typically, they write a script or two, maybe send you to the lab to get some work done and a workup on your blood or whatever it is. And then send you home and you start medicating. And you're medicating the symptoms or managing the symptoms. I really don't think that that is health care. That's not really taking care of our health, it's taking care of symptoms. If we really want to take care of our health, and we should be proactive. In fact, I'm all about taking ownership of your health. Then we should go to the root cause. And that's what my show is all about. Every one of them, we go to the root cause, particularly mentioning stem cell activators. Now, later in the show, we're going to delve into the heart. My wife, Lori, and I are going to delve into that, and we're going to break it down real well, various conditions that are related to the heart, cardiovascular conditions, some testimonials, and then how to take the activator specifically for the heart. But here in this part of the show, because we have 27 different activators, I like to share testimonials or frequently asked questions about all the activators or other ones so that you can get a reminder that there's more than just, in this case, the heart, okay? In fact, while we're going through the show and while I'm talking to you, I want you to look at the bottom of the screen and you'll see all 27 activators. And you'll notice that we talk about we call them the possible applications. And so if you're not relating to what I'm going to share with you with this testimonial or the heart later on in the show, you may have a lung issue or a joint issue or maybe nerve issue or whatever it is, just to remind you that they're available for you, but 27 different ones. But listen, I want to share with you a testimonial from a woman that has been dealing with osteoporosis and the stem cell activator OST. It's Marie from New York. She says this here: I've been dealing with osteoporosis for many years. My bones have been very thin and brittle. I lived with the fear of falling and breaking my bones. Now that's a horrible way to live life. I was taking a medication called Prolia, which cost $1,000 per prescription. $1,000 per script. Now, I don't know about you, but that's an awful lot of money to be wasting on symptoms. This is why we go to the root cause. This is why it is so important that we do everything we can, at least that's my suggestion, do everything we can naturally before we opt for surgery or even medications, because we have to remember the body was designed and created to heal itself. Okay, this medication she's taken, I just want to do a little sidebar here and share this with you, but the medication she's taken is Prolia, and it comes like with every medication, side effects, okay? Let me read some of the common side effects. So if you take this here particular medication, besides it costing you $1,000 every script, this is what's going to happen. You're going to have a reduction or low calcium levels, especially if you have kidney problems. You're going to experience weakness, constipation, back pain, muscle pain, pain in your arms and legs, anemia, diarrhea, skin problems like eczema, blisters, dry skin, peeling, redness, itching, and small bumps. This you're going to have to experience, these side effects, just for taking a medication that has nothing to do with that. And if you stay on that medication, like you maybe are staying on others, which are producing more side effects, you're going to be given more prescriptions to chase those side effects. And you can see the downward spiral of our health in attempts to get healthy, when that is not the path to take, going to the root cause, okay? Let me read just a little bit more, and then we're going to listen to the rest of her story. Now this I pulled from a medical journal. You may also be more likely to get a serious infection if you take this particular medication, such as skin, ear, stomach, gout, even bladder infections. But if some of these signs develop, they want you to contact their physician. Here's some of the more signs or symptoms. Fever, chills, night sweats, red, swollen, tender, warm skin, with or without pus. I mean, come on. You may break out in pus balls on your arms and your back and stomach. Severe stomach and abdominal pain, ear pain or drainage, trouble hearing, frequent painful burning when urinating, pink bloody urine, severe itching, burning, rash, blistering, peeling, dryness of skin, shortness of breath, pinpoint purple or red spots under your skin, flu symptoms, and even weight loss. Now think about that for a minute. Just to take care of a particular condition, and I'm really not bashing doctors or the medical community, but this is the protocols that we have at hand, and that's why my shows with the Stem Cell Activators gives you more options, because if not, you're going to become a walking medicine cabinet, and before you know it, you're going to be sicker than what you started off with because of all the side effects that you're incurring. And that doesn't mention all the toxicity that's building up in her body. Anyway, let's go back to the rest of her story. After taking my first 2 bottles of OST Activator, that's the Activator for Osteoporosis, my doctor did a bone density test and told me I no longer have osteoporosis. I am no longer on the medication. Unbelievable. Thanks to Dr. Christiano. Now listen, when she says she's taking or had taken 2 bottles of the Activator, here's a typical bottle of our Activators. And if she was taking, which normally she would, and anybody else that we recommend, you would take about 20 drops, up to 20 drops a day. We'll say you take the max. You're taking 20 drops a day, you put it in about 2 ounces of water on an empty stomach, and you do it faithfully every day. She went through 2 bottles, okay? A bottle would last you approximately 25 days, 26 days, if you're taking 20 drops a day. So she said 2 bottles, so less than, think about this, less than 2 months, she went back to the doctor and had a bone density test. You know, we recommend that if you start off with an ailment and you start with the Activators, that you actually have blood work or labs done or whatever to have some type of record on file as a starting point. Then what you do, you start on the Activators, you take them for whatever period of time you should be taking them, but you monitor your progress by going back and have another test. In this case, she did that after her 2 bottles or about 2 months time. So after she goes back and she has that bone density test, her bones are now starting to solidify. And she's out of the woods, so to speak. She's not dealing with osteoporosis anymore. She's not having the same discomforts, but also the fears that she was living with. She was living with the fear she attested to as far as the fear of falling and breaking bones. And we know that, and particularly women, as women age, the bones get more and more brittle. And so when you have a fall, a slip, it could be, you can be riding your bicycle, you could just fall in the house, trip on the rug or something. Many times the bones break, and the more brittle, the more difficult it is to heal, and the time for recovery almost is indefinite because the condition is worsening. So in this case, and like any case where we are medicating for the condition at hand, we have to be very careful not to allow the tank, so to speak, to go empty. That signal, that symptom is that warning or alarm that's saying to you something is going on down here. Please help us out. And so hopefully you'll gain from this show and all the other shows how stem cell activators can help you. Now, before we get together, and that's Lori and I, we're going to break that section down on the heart and the stem cell activator for the heart. Let me give you a little bit of a brushstroke on stem cells, how they work, kind of stem cell 101, and how we correlate the activation, because here you're learning about activating stem cells. Well, what are the stem cells and what do they do? When we're born, we're given genetically speaking, stem cells as part of our genetics, part of our makeup. And these stem cells, which are millions of them, are designed to do one particular thing: heal and repair damaged tissue and cells in the body. So when you experience a fall, a break, a trauma to the body, a broken bone, a fractured bone, these stem cells become that particular tissue or cells that have been damaged. And that's how your body repairs itself. And if your body is functioning properly, then that's great because it's going to heal and you'll see it. But when we have a condition and it seems, we're making progress and we have a relapse, or it seems like it's nagging or it's not getting better, in fact, it's getting worse, then what's happening is we're experiencing a chronic condition. And that's an indication that your stem cells, now when I'm talking about stem cells, I'm talking about adult stem cells, not embryonic. Your stem cells are not functioning normal. And that means they're not signaling, meaning cells signal to one another. It's called cellular communication. Like me talking to you on the telephone. If we have static, you can't hear me, you're not getting the message, and so on and so forth. Well, it's sort of like static in the line with your cells. And so consequently, because they're not functioning properly, that's healing you, your body is now breaking down, your body's sending up symptoms. So we take the stem cell activator. When we take the activator, the 27 different ones for 27 different ailments, what happens is they are targeted and will go to that specific area. Now in this case with Marie, it was her bones, so she took the one specific for the bone. And what happened is the bones didn't repair by the stem cell activator. The activator repaired the stem cell. And kind of like turning them back on so they can do their job, get rid of the static, so to speak. Now your stem cells are returning to normal function and now able to do their job, which is what? To heal your tissue, whether it's bone, nerve, it doesn't matter what it is. And so the activation is what turns on your stem cells or rejuvenates them so that they can do their job, and that's repair and heal the particular body. Everybody's different, and the repair or the recovery time is going to be unique. So when you start these, hang on, just do the testing and retesting, and we'll see how you do. Now, without further ado, let's listen what Lori and I have to say about the heart and the activator for the heart. Hi, I'm Dr. Joe Christiano. Welcome to Stem Cell Revolution. Beside me, I have my beautiful wife, Lori.
Hello.
How you doing, babe? Hey, listen, we're talking about diseases and conditions, cardiovascular conditions. In fact, today we're going to focus on cardiovascular issues and health-related conditions because you and I need our power pack. Without
Yes.
that battery, we're in real trouble. And so we're going to dig in, give you some good information about it. But I want you to understand that we look at the root cause to all the problems that we deal with. And many times a condition is given a title or a name, but it's really a symptom. It's just a symptom. It's not necessarily a disease. It's not something you should own, but be aware of that your body is sending up a signal. That's right. That's what it does naturally. When something is out of balance, when we are not in homeostasis, where our cells are balanced, the body starts firing up a warning sign. Okay, just like When there's a fire, there's smoke. The smoke lets you know there's a fire. Right. And so if you just go after the smoke, guess what's going to happen to your house? It's going to go right down to ash. And the same thing with your heart or any other organ like the kidneys or anything else. So we're going to show you a few things today about cardiovascular health, and maybe this will help you if you're dealing with something like that.
Yeah, today, so we're talking about the stem cell activator for the heart, and that is HRT for heart. And these are all natural. That's the best thing about these activators. They're all natural, they're all plant-based. They don't interfere with medications or supplements. They're very easy to take, which Dr. Joe will show you in a little bit, but they're all natural. So there's nothing to interfere with anything that you might be taking now, but these are something that you might be considering, and the possible applications for to take the HRT. I'll read.
Well, let me stop you before you get into that. That's real important what you're talking about. A lot of people that are dealing with cardiovascular issues, AFib or whatever they're dealing with, are on medications. And I know that from experience, when you're on a medication, there's multiple side effects, okay? And then when you take another medication, that just increases and intensifies the side effect issue. And before you know it, you're going to be treated for another condition or conditions that weren't even part of the original problem. And so to just relieve your mind, these activators are not going to interfere with your medications. They won't interfere with your supplements because of the way they're designed with nanotechnology. The peptide that these are made of have had the nanotechnology added to it, which reduces the molecular structure. It reduces the molecular structure so small, we call it nanoparticle, that the human body, your body cannot determine if the amino acids, which are the peptides in the activator, are from plant or animal.
Amazing.
That's how small it is. But they're extremely powerful and yet totally harmless to the body. So I just want to reassure you that before we get into that.
Yeah, and the good thing is that they don't interfere. I mean, that's
really the
bottom
key.
line
Yeah.
is, and they're all natural. So
yeah, because if you're on a protocol, a long-term medical or a medication protocol, you're thinking to yourself, one, if I take anything else, is it going to interfere? And two, I've got to be on this for the rest of my life, and so there's a fear element, and I don't want you to be paralyzed in making a decision based on fear. And so we've had, Lori will share these testimonials with you, and we have them in the book as well. These are people that are not trying something out because they feel a little twinge or they got a little hiccup. These are people, many times, are people that call the office or email us and tell us a litany of problems that they have and a litany of medications they're taking. And lo and behold, when they start taking the stem cell activators, the body starts going through its process of reactivation and healing. And before you know it, some of these symptoms start to dissipate and disappear. Yes. And our goal is to see if we can't help you to the point where all the symptoms disappear because the root cause has been fixed and you have a wonderful life.
Yes, and so the Heart HRT activator, I'm going to read what some of the people or symptoms that people have that should try and start, using the activator to help their condition. Sure. So the heart support helps regulate intercellular communication and support cellular and tissue regeneration in the heart and the cardiovascular system. Possible applications would be coronary and valvular heart conditions. A lot of people with valvular conditions out there.
Malfunction.
Arrhythmias, history of myocardial infarction, which is a heart attack.
Yes.
People with heart failure, cardiomyopathy, AFib, so many people with AFib, and much more. Anything that deals with the heart, that's the one you would want to take.
Sure. And we're talking about cardiac tissue, cardiac cells, and if they're damaged, just like in any system or in any organ, but in this case, if you have cardiac tissue or cells that are damaged, that heart can't function normal. It's just like I said, when there's a root cause, there's symptoms. And AFib being one of them, even a heart attack could be another. And people are giving different medications to treat the symptom, but that damaged tissue, that cardiac tissue, isn't getting better. And so it's only going to get worse.
Exactly. And so there's so many people who call in the office and they're saying, I can't even walk to my mailbox. I can't function, my heart isn't giving me enough oxygen to even function with the, just walking to the mailbox and coming back. It's like they have to have a chair at the end of the driveway just to get the mail. And that's not a good sign.
No.
That shows you there is something going on with the heart.
Yeah, I counseled a woman who was very similar to that scenario because after we discussed her condition and all she was taking as far as medications and things, I says, are you physically active or what level of fitness and fitness activities do you participate in? She goes, Dr. Joe, I have a difficult time walking to the mailbox. Mm-hmm. You know, and I understand that. It's hard for me to totally grasp that because I'm such a fitness enthusiast, you know. And I push my body, at 70 years old, I push my body continually, not to prove anything, but, you know, if I don't push my body, if you won't push your body, if you don't get off the couch, you're going to get worse. If you need to improve your circulatory system, your circulation, and the muscle and the soft tissue in your joints, you have to get up and start moving. So I encourage her. I said, listen, if you can't make it to the mailbox, go halfway and then come back. Do it a couple of times. In other words, ease yourself into this. This is, of course, lifestyle, which I talk about in the book. But exercise is key. But let's talk now and focus more on stem cell activation and maybe something that you've never heard of before that you can now take advantage of.
Yeah, and we do tell everybody to give it 90 days. You know, it's not something that you just take one bottle and see how it takes time. Some people feel great right away. Some people it takes several months. So we always say give it at least 90 days. And do an evaluation at that point. And the other thing is, if you don't know what activators to order or take, that's what our staff can help you with. You know, call our office. We will help direct you. You can take up to 4 different activators at a time. Mm-hmm. We have 27 different ones. But we have people who want to take 20 of them. You know, we always say, no, your body can only handle so much. Yeah. So it's been really an amazing way of going and a good option to take something natural that activates your stem cells.
And you know, Lori, I want people to give it at least a 90-day shot, and the reason for that is to get that serum level up high. There's no side effects. It's not going to interfere with the meds they're taking, or it's not going to interfere with nutrition or anything else. It's just going to do its job, and that is, in a natural way, repair the damaged tissue. In this case, cardiac tissue, heart tissue that the stem cells can't heal right now. So if we can enhance an improvement in the function of your stem cells, your cardiac stem cells, they're going to go back to doing their job, and that is starting to heal the tissue around it. And once the tissue starts to heal, the function of the heart starts to improve. Can we get it all the way back to 100%? Well, everybody's a different story. Everybody's an individual case. But 90 days is, you know, just taking these drops, and I'll share in a minute or so how to take them. It's very, very simple. You take it daily and you know, maybe have it monitored. If you are under a cardiologist's care, I'm sure you're going through various tests periodically. And the day you start the activators, you can go with your current test, you know, and the readings and the printouts. And then once you have a retest, whatever it may be, now you can make a comparison. And I'm telling you what, your cardiologist is going to freak out a little bit because he or she's going to see some improvements that she's going, well, what are you doing?
That gives me a good testimonial. I had a lady who bought some activators for the heart, HRT, for her son, who has terrible heart condition. And so she said, just start taking these, son, and just let me know how it goes. So she called him after a while and said, how are you doing? Well, I don't know if it's working right now. You know, I'm going to go to my cardiologist and have a test done, but I don't know. Can't notice any different. Well, he went back to the cardiologist, and the cardiologist said, oh my gosh, your heart is so much stronger. Yeah. And I said, well, how did they know that the heart was stronger? I was kind of confused. How would they know that? They did a nuclear test on his heart and could tell the heart was so much stronger than it was before. So she ordered more bottles for her son. I mean, it tells you sometimes you can't necessarily tell a difference. Only when you go back to get retested in the medical field are you going to know that there's something going positive.
That's a great way to prove what you're testing and trying.
Yes.
You know what I mean? Because you're on some protocol of medicine, and I always say this. You know, of course, in the clutch situation, you know, take your medication. You know, but long term, you can't stay on it. Well, let me put it this way: if you prolong the condition, if you allow a condition to carry on, it's going to get worse, and you're going to degenerate over time, and you may get to a point that even this cutting edge technology and therapy can't help you, and then there's no return. So I really want to encourage you to think through these things and take advantage of these great technologies.
And the good thing is they're so easy to take.
Yeah.
I mean,
Yeah.
all you have to do is put little drops, 20 drops, in about 2 ounces of water.
Just do a real easy squeeze on the
Little
the dropper.
So you do 20
yeah,
drops.
just like that.
You put it in your mouth for 20 seconds, swish it around, swallow, and then you wait 20 minutes before you eat, brush your teeth, take your medicine. Just do this very first thing in the morning.
On an empty stomach.
And on an empty stomach, and it's the best way to get it over with. That's all you have to do. And then you wait. And then I've got like people with the heart condition, like AFib. I have a really good testimonial on that one.
Hear it.
And this is just taking the little drops, you know, every day. It says, for over a year, I have had several scary bouts with very bad AFib. I ended up in the hospital each time. The hospital couldn't help me, so they sent me home with all kinds of meds, and then that's all they could do. So I decided, why not try the Heart HRT Activator? I've been on it for 2 bottles, and I haven't had any bouts of AFib since. I am now an advocate and sharing with all my friends. Thank you, Dr. Joe. But this particular gentleman, he told me he would go into the hospital every month. It was like almost every month he was going in because he had such terrible AFib going on. And he said, even since then, he has still not had the AFib problem. He's never had to go back into the hospital.
That is just so
and
good.
so we're always telling people to,
good.
give it 90 days, see where you're at, and then make it, see if you need to just continue on, or if you can even come down to a maintenance dose. It's really an easy way to go.
So, just by hearing that, I know the fear that people have, when they're dealing with heart, and you're afraid to do much because you don't want to have a heart attack. You don't want to die. But there are things like this, and we're able to share this with you, these testimonials. We're not making it up. We wouldn't know this person from anybody else unless they let us know how they're doing. But we need to share that with others for the sake of hope, giving you hope. It's natural, and it's proven itself, it's evidence-based, and it's new. So now you're equipped with some new information. There's options now in my book, and in fact, you go to the website or call our 800 number and we'll give you more information and things like that. But now you're equipped to handle a situation. Should you have a cardiac issue or know somebody that does, you can refer this to them. But it's going to make a difference long term. You've heard some of the people in their testimonies went from almost near death or terrible lifestyle to improved health. And a lot of people say, thank you for giving my life back. Well, I won't take that glory, but I will jump in with them and cheer with them. So take advantage of the information you got and see if you can't turn your health around too.
If you would like to order our stem cell activators or Dr. Christiano's book, Stem Cell Revolution, please call 1-800-259-2639 or go to our website at bodyredesigning.com.